Hello, this is Ruth Hollingshead, trustee for Sight for Wight, welcoming you to this week's Talking News.
Sight for Wight Talking News for Friday the 19th of June 2020.
Hello, this is Lisa, the interim CEO of Sight for Wight. Our dress agency, Dress for Less, has now got a date to reopen. This is Thursday, the 2nd of July. We are delighted to announce that due to an enormously successful appeal for clothing to be donated to the shop, it is now full of donated items which can be sold to raise vital funds for the charity. Like all charities, the COVID-19 lockdown has stopped our physical local fundraising, but we did not want to be just another charity asking for cash donations. So we raised an appeal through the county press and social media asking for smart casual and formal occasion clothes to be donated for onward sale. The response has been phenomenal. We are still sorting out clothes 3 weeks later, and our shop manager Debbie said, "We're over the moon with the generosity of people at this very difficult time." We are still accepting donations of smart casual and formal occasion items, so do not hesitate to call the main charity on 522205 if you feel you're able to help. We are in the process of recording a video and separate audio tour of the shop to give people advance warning of its new layout and the social distancing measures we have put in place. But in brief, the shop, which can be found at 114 St James's Street, opposite the Man on the Moon public house, has double automatic front doors which open outwards. As you enter, you will be greeted by one of our volunteers who will offer hand sanitizer, disposable face masks and disposable gloves for you. The one-way system then goes round from the right-hand side up through to the cash till, then down the left-hand side, with 2-metre tape indicating 2 metres distance. We are asking people to pay with cards, no cash, and our changing rooms are closed. Debbie and her team of volunteers are very much looking forward to greeting you and helping you choose your new summer outfit. We do not have a date to reopen Millbrook House yet due to the continuing government restrictions, but will of course report back as soon as we are able. The audio library, however, is open 1 day a week, with Kate working tirelessly to exchange books for those who wish. We also want to wave goodbye to Laura, our Member Services Manager. Laura has decided to take the chance to return to a more practical role in helping people with sight loss, taking up her new role at St Mary's Eye Clinic. We know some of our members have already bumped into Laura at the hospital and know a friendly, familiar face always helps, especially in these challenging times. All the staff and volunteers are very much look forward to welcoming you back and hope to be able to bring some more definite news soon. Thank you.
Alison, reading from the Isle of Wight Observer. Over 40 historic properties, including Osborne and Carisbrooke, will reopen to the public on Saturday the 4th of July, English Heritage has announced. Following the closure of all of its staffed sites in March as a result of the coronavirus pandemic, the charity will once again be welcoming visitors to its larger sites with outdoor spaces, castles and abbeys with extensive grounds, sites with large historic gardens, and places like Osborne where there is plenty of room to roam. New measures will be introduced by the charity to ensure the health and well-being of members, visitors, volunteers and staff, and those who visit can expect their day out to be a little different with social distancing in place. To ensure a safe and enjoyable experience, visitor numbers will be limited, and all those planning to visit, including members, will have to book in advance on the English Heritage website and arrive during their time slot. Only those with pre-booked tickets will be permitted entry, although once on site, visitors are welcome to stay as long as they like. Isle of Wight sites reopening on the 4th of July. Osborne. It is impossible to imagine a prettier spot, said Queen Victoria of Osborne House, her palatial home on the Isle of Wight. Walk through the garden terraces, where the stunning views across the Solent reminded Prince Albert of the Bay of Naples, before taking a stroll down to Queen Victoria's private beach. Please note, the house, along with the Swiss cottage and museum, will remain closed. Carisbrooke Castle. Sitting high and proud at the heart of the Isle of Wight, Carisbrooke Castle has been an artillery fortress, king's prison, and a royal summer residence. Today, it's the quintessential romantic castle, with lots to see and enjoy in the fresh open air. Experience far-reaching panoramic views from high castle walls, or wander the moat to discover King Charles I's bowling green. Enjoy the tranquil Princess Beatrice Garden before meeting the famous Carisbrooke donkeys. Please note, some small indoor spaces, including the well house, castle chapel and museum, will be closed.
This is Brian reading an article from the Isle of Wight County Press. What is the COVID alert system and what do the changes mean? The UK's chief medical officers have agreed to downgrade the coronavirus alert level from 4 to 3 following a steady and continuing decrease in cases in all 4 nations. Localised outbreaks of COVID-19 are still likely to occur, the advisors warned, and the virus remains in general circulation. But the downgrading, recommended by the Joint Biosecurity Centre, JBC, means transmission of coronavirus is no longer considered to be high or rising exponentially. England's Professor Chris Whitty, Northern Ireland's Dr. Michael McBride, Scotland's Dr. Gregor Smith, and Wales's Dr. Chris Jones agreed with the JBC's recommendation. But what is the alert system and how does it work? Here's what you need to know. What is the alert system? The COVID alert level system was announced by Prime Minister Boris Johnson in his televised address to the nation on May the 10th. The system is similar to that used to establish the terrorist threat and will be run by a new Joint Biosecurity Centre. It has 5 tiers from level 1 to 5 based on the spread of COVID-19 through the country. Mr. Johnson said that the country's current alert level will be determined primarily by the virus reproduction rate, the average number of people that will contract coronavirus from an infected person, and the number of coronavirus cases. The level will then inform the government what measures are needed to combat the spread of the virus, with higher levels requiring stricter controls. What are the different levels? When the scheme was launched, the country was at level 4, which means a COVID-19 epidemic is in general circulation, transmission is high or rising exponentially. The system says that current social distancing measures and restrictions should remain in place. Level 5 is when transmission is high or rising, but also when there is a risk of healthcare services being overwhelmed and will require an increase in social distancing measures. Level 1 means COVID-19 is no longer known to be in the UK, and the only action should be routine international monitoring. Level 3 is when the epidemic is in general circulation and gradual easing of restrictions can take place, while level 2 is when the number of cases and transmission is low and no or minimal restrictions are required. But under level 2, there will be enhanced testing, tracing, monitoring and screening. Who monitors and sets the level? Mr Johnson said he was establishing a joint biosecurity centre to run the alert system. Cabinet Office documents said that the centre will provide real-time analysis and assessment of COVID-19 outbreaks at a community level to enable rapid action to stop spikes in infection. It will also advise on specific actions which can be taken to manage rising numbers of infections, such as closing schools or businesses. The centre will also inform the Chief Medical Officers of a change in the COVID-19 alert level, who will then advise ministers.
This is Chris reading an article from the Isle of Wight Observer. Plans to increase SEND provisions at 2 island schools. A public notice has been issued by the Isle of Wight Council informing residents of its plans to increase special educational needs and/or disabilities (SEN) provisions at 2 island schools following a review of specialist education places. Published in November last year, the Isle of Wight Council's strategy for SEND provision for children and young people from 0 to 25 years identified trends in the current SEND populations on the island and projected trends. The strategy outlined where additional provision was required and made recommendations for development. One area, at Honey Hill Primary School, is a pilot scheme started in September 2018, which could become permanent, providing continued support for 8 children with social, emotional and mental health difficulties, SEMH. The second recommendation is at St George's School in Newport, that provides an education for young people aged between 11 and 19 years old with complex learning difficulties. The school is almost full, with the current number of pupils registered at 174, 2 away from its 176 capacity. From September the 1st, the planned admission number will rise to 188, providing 12 more specialist spaces for SEND pupils. In the Council's SEND strategy, it was found a further 38 secondary places would be needed for pupils with profound and multiple learning difficulties, speech, language and communication needs. The proposal for St George's, if agreed, would potentially create 12 of those places on a satellite site at the Isle of Wight Education Federation's Node Hill Sixth Form site.
This is Howard reading an article from the Isle of Wight County Press about food standards. The NFU's petition on food standards has been backed by more than 1 million people, urging government to ensure future trade deals do not lead to the importation of foods that would be illegal to produce here. The overwhelming public support, boosted by celebrity chef Jamie Oliver and the Mail on Sunday, has accumulated in just 2 weeks. In addition, more than 78,000 people have also written to every MP in the country, urging them to support the introduction of a Trade, Food and Farming Standards Commission that can review trade policy and ensure all food imports meet the UK's high standards. NFU President Minette Batters says, "It's been overwhelming to see this volume of support. It's simply not credible for the government to continue to just pay lip service to this issue when there is such public support for action. They must now give guarantees to the British people that they've listened to their concerns and will make firm commitments to address them." NFU South East Regional Board Chairman David Exwood, a West Sussex farmer, says, "This means so much to us as farmers. It's a clear indication of public sentiment. It sends the strongest signal yet to government that the British people don't want to see food that would be illegal to produce here on our supermarket shelves or in our restaurants and cafes. Mr. Exwood, who himself runs a mixed farm with a farm shop at Itchingfield near Horsham, added, "Foods such as chlorinated chicken or hormone-fed beef fall well below the standards we British farmers adhere to, and people don't want imports of food produced in systems with lower levels of animal welfare or environmental care than we have here." Minat Batters explains, "Trade policy is complicated, but what the public are telling us is quite simple. They care deeply about their food, where it comes from, and how it's produced. Farmers, animal welfare groups, environmentalists, and now the public have made their voices clear." She added, "These are decisions that will leave a legacy for decades and generations to come. It's so important that we get this right. Access to safe, traceable, affordable, and nutritious food produced to the highest standards should be a right for all. We must not throw that away in the pursuit of free trade." The online petition can be signed here via the Countryside online website.
This is Den reading from the Isle of Wight Observer. New strategy will help Council keep residents healthy for 5 years. At a meeting of the Isle of Wight Council's Cabinet last week, Director of Public Health, Simon Bryant, introduced a strategy which will help the Council keep residents healthy for the next 5 years. He said, "We know people want to be healthy. Having a good quality of life and being in control of their health is important. This strategy sets out some key issues for us to improve the health of the island's population, how we manage demand for services, and we know we need to move to a wellness model, shifting to preventative and early intervention models. This does come at a time of public health emergency, and we really do need to focus on protecting and promoting the health of the population." The strategy is laid out in 5 sections, which focuses on different aspects of life to ensure the well-being and health of residents. The first is for a good start in life, the first 1,000 days of a child's life, starting from pregnancy until the age of 2, laying the foundations for brain development and healthy growth. This will include support for parents to be in good health before the baby is born, and a particular focus on getting smokers to quit before the birth, commissioned services for caregivers and in accident prevention to avoid children experiencing physical trauma. Also, provisions to give a good education for every child, promoting a healthy learning environment due to the strong relationship between education and future health and well-being, which the Council's strategy says is a contributing factor to greater employment opportunities. Second is physical well-being, healthy lifestyles and healthy ageing, as the life expectancy on the island is increasing. However, the strategy says that although we are living longer lives, we are not living healthier ones. So a focus will be on preventing avoidable illnesses as a result of smoking, poor diets, lack of physical exercise, and excessive alcohol consumption. The island has one of the oldest populations in the country, and it is thought by 2028 almost 1 in 3 people living on the Isle of Wight will be over 65 years old. The approach to supporting older people to remain in good health for as long as possible will continue. Tying in with the second, mental well-being, the third section is being given the same amount of importance, with a big push to promote positive emotional well-being, early intervention, and reducing the impact of disorders. The fourth section, Healthy Places, is about providing healthy communities for people to enjoy living and working in. Risk factors of serious violence will be used to reduce harm, particularly domestic violence, while healthy settings, including green and blue spaces, food environment and planning decisions, will also play a part. Finally, protecting the population from harm in the form of prevention and preparation and response to emergencies, such as outbreaks and infections which could pose a threat to the community. The Council says it will work with partners to increase the uptake of childhood vaccination programmes to prevent outbreaks of infections such as measles, which had been declared eliminated in England, occurring on the island. It was recognised by Mr Bryant that inequalities underpinned the strategy and that some people don't experience good health in the way others do, but pledged to tackle them wherever they are found in the strategy. Councillor Claire Mosdell, Cabinet Minister for Adult Social Care and Public Health, said it was appropriate to present the strategy now, which was delayed due to COVID-19 during a public health emergency. She said, "The pandemic reminds us good public health is essential for a prosperous, healthy island. Tackling issues like dementia requires action across the whole life course, and we know it is important to take action at all stages of life. Mental and physical health are of equal importance, and connected with positive lifestyles can positively impact on both aspects of health." Cabinet members voted unanimously to approve and adopt the health strategy, which will be in place until 2025.
Hello everyone, this is Steve and I'm reading an article from the Isle of Wight County Press headlined "Lessons Learned Despite Technical Barriers Scuppering Isle of Wight Coronavirus Phone App." This week the government scrapped the Isle of Wight Coronavirus app, with Health and Social Care Secretary Matt Hancock conceding a technical barrier was to blame. The Coronavirus Test and Trace app has been abandoned in favour of a Google Apple design, which will be introduced later in the year. Speaking at the Daily News conference yesterday, that's Thursday, Hancock said they have discovered a technical barrier which every other country building their own app is also now hitting. He said, "Apple's software prevents iPhones from being used effectively for contact tracing unless we use Apple's own technology. After we started work on our app, Google and Apple began working on their own product. As soon as they did this, we began working with both. We kept our options open." Hancock said through testing they found Google and Apple's product did not estimate distance well enough, which he said is mission critical. Following rigorous field testing and a trial on the Isle of Wight, the government has identified challenges within both its own app and the Google Apple framework. It will now be taking forward a solution that brings together the work on its app and the Google Apple solution. The government said it is an important step and will allow the development of an app which will bring together the functionality required to carry out contact tracing, but also make it easy to order tests and access proactive advice and guidance to aid self-isolation. The government, local council and all partners involved have praised the positive response and support for the app on the island, and the vital role which its residents have played, and will use the valuable insight in the next phase of its work. Isle of Wight MP Bob Seeley conceded he was sad at the decision not to proceed with the app, but said the important thing is that the island played its role in testing it. Hancock said, "We knew from the start that it was imperative to be bold, but also to test and learn as we developed this new technology. The NHS COVID-19 app has undergone some of the most rigorous testing in the world, and the Isle of Wight has led the way. A huge number of people on the island have dedicated time to this project, and we are hugely grateful. Residents on the Isle of Wight have led the way, and the feedback from islanders will remain at the heart of our approach going forward. Further information will be provided to residents over the coming days." Reacting yesterday, Vic Lothian said islanders were used as lab rats for a costly experiment, while Richard Quigley said we should still be proud for trying to make something constructive happen during the crisis. Nick Stewart has slammed the government's flawed approach and said it could have been handled so much better.
Hello, this is Sue reading from the Island Echo. Increased support for people with autism on the Isle of Wight. A new service to support children and adults with autism during the current COVID-19 pandemic launched on Wednesday the 17th of June. The Isle of Wight Autism Support Hub will provide support to children and adults who may be feeling isolated or overwhelmed, as well as to their families and carers. It can be accessed through a number of ways, including a peer support phone line, 5 days a week, Monday, Wednesday and Friday, 4 o'clock to 9 o'clock, and Tuesday and Thursdays, 11 o'clock to 4 o'clock. Dr. Chris Ainsworth, Deputy Director of Mental Health and Learning Disabilities at Isle of Wight NHS Trust said, "Individuals on the autism spectrum may be struggling more during this period in a number of different ways, and it is, therefore, important we have in place even more support to help people through this pandemic. We are therefore delighted to have partnered with AIM to set up this support service, which amongst other things will help people with autism understand what can sometimes be a complex situations. The hub, which is provided by Autism Inclusion Matters, AIM, on behalf of the Isle of Wight NHS Trust, can be contacted as follows. Telephone 07498 500607. Facebook at AIM, Isle, ISLE of Wight. Skype, search IOW Autism Support Hub. Email support@aimisleofwight.co.uk. Helen Figgins, Service Manager for Central Community Services, Mental Health at the Trust, added, "There has been feedback that more support was needed on the island for those who are struggling, more so during the pandemic. Setting up this service is an important step in ensuring we can further guide people through these challenging times." Speaking on behalf of AIM, Claire Collins encouraged people with autism on the island to make use of the new service. "We talk to people who are very anxious or worried, people who may be lonely and just want to chat, people who need help with daily life, people who are frustrated and need someone to listen. But most of all, we want to share our experience with anybody that might benefit. If you are not sure if we can help, let us try." The Isle of Wight Autism Support Hub will initially run for a 3-month period and will be reviewed thereafter to decide on whether there will be need for it to run longer.
This is an article from OnTheWight, read by Terry. West Wight Hub receives £10,000 grant to help support their work during coronavirus. The grant will help West Wight Sports and Community Centre continue to support over 500 residents during the coronavirus outbreak. Coronavirus has challenged the whole nation, causing fear, grief, panic and disruption to the way each one of us goes about our daily lives. The National Emergencies Trust, the NET, has partnered with HIWCF to award West Wight Sports and Community Centre a grant of £10,000 to help those most affected by the crisis. Thanks to the grant, more than 500 vulnerable people in the west of the Isle of Wight will continue to receive essential help from the West Wight Coronavirus Support Hub. The hub is managed by a team consisting of representatives from local churches, staff and volunteers from West Wight Sports and Community Centre, the WWSCC, and Freshwater Parish Council. It operates from WWSCC, and the grant will ensure the service can continue when the centre reopens as a sports centre. The hub coordinates 310 volunteers whose roles include delivering prescriptions, providing a shopping service, relieving loneliness through regular phone calls, providing a helpline for practical problems such as appliance repairs, cooking and delivering hot lunches, and sewing scrubs for care homes and face masks for members of the public. Claire Griffin, manager of WWSCC, said, "Thank you very much to NET and HIWCF for providing this funding, which is essential to ensure that we are able to carry out our services, our project, and make a real difference to people's lives." We are delighted to be able to support WWSCC in their work to help those in need in the local community. Local charities, community groups and voluntary organisations are providing a lifeline to those less fortunate, and it is heartening to see that these organisations can react so quickly and be so resourceful in the face of the coronavirus pandemic. The vital services that these organisations provide are more crucial now than ever before, but are under threat more than at any other time. HIWCF is continuing to raise funding for charities across our region, for which donations can be made to the We're All Together Fund.
Alison, reading from OnTheWight. Isle of Wight businesses affected by COVID-19 encouraged to apply for a discretionary grant scheme. The Isle of Wight Council has widened who is eligible for financial support via the local discretionary grant scheme to help businesses affected by COVID-19. The local discretionary grant scheme to help eligible island businesses has reopened for applications following a short suspension to review the criteria and allocation of remaining funds. A sum of around £1.34 million remains from the government allocation of £2.96 million. So businesses are asked to check the amended criteria to see if they qualify and apply as swiftly as possible. This can be done via the website. More than 200 additional island businesses, covering a wide range of sectors, have so far received grant funding totalling £1.62 million under the discretionary grant scheme set up locally by the Isle of Wight Council just 3 weeks ago. The review has added privately run preschools and larger pubs to those businesses which may qualify. The Council is endeavouring to directly contact businesses in these categories, for which it has verifiable details around eligibility. The Council's Economic Development Team was one of the first in the region to get a local discretionary grant scheme underway and has already helped many island businesses which missed out under the government's larger initial grant funding initiative. The government allowed a degree of local discretion in applying the funding. Council leader, Councillor Dave Stewart, said, "It is excellent we have been able to extend our local criteria to help more island businesses in these crucial areas, and I would urge them to apply as soon as possible to have the best chance of accessing this funding." The £1.62 million we have been able to allocate to 200 additional island businesses under the discretionary scheme is in addition to the £45.7 million we have paid out to 4,002 island businesses under the government's initial grant scheme for small businesses and the retail, hospitality and leisure sector. We envisage the remaining £1.34 million of the discretionary funding will be fairly swiftly allocated, so it is vital businesses check the criteria and apply as soon as possible if they believe they are eligible.
This is Howard reading an article from OnTheWight regarding the Penny Feathers development in Ryde. Applications have recently been submitted to change the wording of conditions which planners say will allow things to run smoothly. Planners for the controversial Pennyfeathers development in Ryde have said they aim to submit the main application for more than 900 houses next month. This comes after calls from the Mayor of Ryde, Michael Lilly, for the developers to let the planning application lapse so they can listen to the people of Ryde and find out what their housing needs are, as it seems the work is stalling. Outline planning permission was granted in September 2017, and the company behind Pennyfeathers have got 3 years to submit further details for approval, which runs out in less than 3 months. 2 applications have recently been submitted to change the wording of 3 conditions which planners have said will allow things to run smoothly going forward, as the application will be made by the deadline. Glenn Hepburn, who runs Hepburn's planning consultancy with his wife Kathy, said, 3 years is the law, we cannot change it. The reason the government gives 3 years is because they feel it's the right amount of time to make the application. This is not a standard application for 2 or 3 houses. It's a big undertaking where lots of bases have to be covered. The reason for the variation condition applications is to try and make sure that when we put the major application in, there are things to support it and everything is lined up so we can actually start building. What we don't want to do is put in a planning application for it to get planning permission, and then we have to go back and try and vary different conditions. It's nothing more and nothing less than that. Hepburns hope to submit the reserved matters application next month, but have left a month of slippage. Responding to criticism, Mr. Hepburn said Councillor Lilly had chosen a certain role in the proceedings of the development and could put whatever spin he wants on things. He said, "We will ultimately just deal with facts. People make judgments on that. I anticipate Councillor Lilly will come from one angle, and the people who have been informed will come from a more agreeable angle to us." Despite a notice on their website, they're closing with no more information. Mr. Hepburn said the couple are only retiring, but are completing contracts, carrying on with the Pennyfeathers application, and may continue providing services to any long-standing clients. A further application has been made in relation to Pennyfeathers to improve the junction at Westbridge Cross, incorporating land from the houses bought by Pennyfeathers Property Company on Marlborough Road. Changes to the junction would see a new left-hand turn lane added to Great Preston Road, filtering traffic onto Marlborough Road and changing the position of the footways around the junction.
This is Chris reading an article from OnTheWight. Review to update single-person council tax discount records. The Isle of Wight Council's regular review of single-occupier council tax discount is underway to check the correct amounts are being paid by households. Letters are being sent out this week from an accompanying form so the council can update its records. The form must be completed and returned. There is also an online version of the form at www.iow.gov.uk/residents/benefits council tax and business rates/council tax services/council tax reductions/discounts. Those who qualify are entitled to a 25% discount on their council tax bills. As part of the review, the council has appointed an external agency using data matching technology to identify where people may be claiming discounts they are not entitled to. A council spokesman said, "If you claim the discount and no longer qualify as a person living alone, you must let us know so we can update our records. We'd also like to remind residents who qualify but have not claimed that they are entitled to do so. The exercise is not just about collecting the right level of tax, but being equitable and fair. The checks form part of the council's measure to prevent and detect fraud and protect the public purse and to ensure claims are by council taxpayers who are genuinely entitled. We would strongly urge all claimants who no longer qualify to let us know as soon as possible.
Hello, this is Steve reading an article from the OnTheWight online news website headlined Extra Staff and Teaching Space Needed for Full Return to School in September, says the NEU. The NEU welcomes the £1 billion pledged by the government, but adds that if social distancing is still required in September, the government will have to find extra education staff and extra teaching spaces. Commenting on the £1 billion education funding announced by the government, the Isle of Wight's Peter Shreve, the Assistant District Secretary of the National Education Union, said, "This £1 billion for schools in England is a welcome recognition of the importance of education. However, if social distancing is still required in September, a full-time return to education means the government will have to find extra education staff and extra teaching spaces. This will take time. If this is to be targeted support with extra tuition, then the key to academic success will be good communication between present staff and the extra staff tutoring. The government must urgently engage with unions and others in the sector to plan for such a return. The National Education Union's 10-point plan is a good place to start. This new money appears to be focused on the academic, and we are conscious that there is and will be a huge need to ensure that broader pupil needs are supported. A recent School Dash pupil survey indicated feelings of loneliness, boredom and poor life satisfaction are widespread. We need a detailed plan supporting their mental health, facilitating more social interaction, encouraging more physical activity, and improving the happiness and promoting the general mental health well-being of young people. Right now, the government should be working on a summer holiday local offer, on delivering broadband to all those children who still need it, and reading books to all children in receipt of free school meals.
Hello, this is Sue reading an article from the Isle of Wight Observer. Clinical trial helps lead the rollout of effective COVID-19 drug. This week, the Department of Health and Social Care have rolled out a drug that has been hailed an astonishing breakthrough by the Health Secretary Matt Hancock, in a move that will help save thousands of lives. The Isle of Wight NHS Trust at St Mary's Hospital in Newport was one of the NHS trusts across the UK that led on the COVID-19 recovery clinical trial into the drug dexamethasone. It has proved to reduce mortality by over 1/3 in patients ventilated with COVID-19. Alistair Flowerdew, Medical Director at the Isle of Wight NHS Trust, commented, "The Isle of Wight NHS Trust was part of the clinical trial for dexamethasone, and today brings good news as this drug has been found to show positive results for hospitalised patients with COVID-19. Patients on the island have contributed to this outcome, having access to this medicine which has shown signs of being effective in COVID-19 recovery. This is great news for our island community and a testament to the Trust's staff in implementing new approaches to treatment during very challenging times. The clinical trial, known as Recovery Trial, is an adaptive, randomised, controlled clinical trial that was set up purely to identify treatment options for patients hospitalised with COVID-19. The Isle of Wight NHS Trust opened this trial in mid-April, with a number of patients recruited and randomised into it." Alistair Flowerdew continued, "Opening this trial has only been possible due to a continued collaboration of teams within the Trust's pharmacy department, intensive therapy unit, research department and medical admissions unit."
This is a message from Peter Williams, Commercial Director at South Western Railway. Dear customer, lockdown has been a challenging time for us all as we've learned to adapt to new ways of working and supporting our customers and colleagues. Although we've had to scale back some of our non-essential activities, we are committed to providing a reliable train service for key workers like NHS workers, supermarket workers, and police who require it. On Monday, the 18th of May, we introduced a new timetable to increase capacity, and although this will remain a reduced service, some routes will see services reinstated for the first time since lockdown began, with other routes benefiting from longer trains with more carriages or some extra services at peak times. On a very practical level, we are encouraging good hand hygiene amongst our colleagues and customers in line with Public Health England. When cleaning stations and trains, we're paying particular attention to commonly touched surfaces such as ticket machines, grab handles, stair, handrails, and door buttons. We're also working to ensure stocks of soap are checked and replenished regularly on board trains and at stations. We're continuing to process refund requests as quickly as possible. If you have applied for a refund, thank you for your patience. For details of the December 2019 strike compensation scheme, please visit southwestern-Railway.com/December-2019-strike-compensation. As lockdown restrictions begin to lift, our priority will be keeping customers and colleagues safe, which is likely to require us all to continue to practice some form of social distancing and minimising unnecessary contact. Smart cards are one way that will help with this because you can order your smart card and buy tickets online and through our app. You can avoid queuing and touching equipment like self-service ticket machines. Smart cards are contactless, which means you collect your smart ticket by touching it on the smart card reader. Smart cards are available for free and can be delivered directly to your home address. Once received, you can purchase any length of season ticket along with our 10-ticket CarNet online. Using our app, you can purchase weekly and monthly season tickets. Customers using our Android app can also purchase a range of daily tickets and load them directly onto a smart card ready to use on your next journey. For more information, visit southwesternrailway.com/touch. Thank you. Sight for Wight would like to thank you for listening to this week's edition of the Talking News. We would also like to thank our volunteers for reading, and a particular thank you to the Island Echo, Isle of Wight County Press, Isle of Wight Observer, and OnTheWight. A special thank you must go to Vectis Radio, who has helped us get vital information to our members.